Good morning, all. It's afternoon almost, and you may be hungry. But we are used to eating at 3:30 or 4 or even 5 p.m. and sleeping at 2:30 at night. So it's like, okay. Anyway, 15 minutes is allotted to me, so I'll make the most of it. So there are 41 slides, and you can see acts, rules, and norms are, sorry. Okay, I'm touching the, okay. So acts, rules, and norms are like dry topics, okay? And you are hungry, so I'll make it quick. Now, Pollution Control Board of Kerala, it was one of the first 12 pollution control boards established in India. Actually, you may be knowing about the Stockholm Conference in 1972, where the nations took a resolution to pass environment laws. So India was a pioneer. Indira Gandhi was the Prime Minister. So we passed Water Act, Water Prevention and Control of Pollution Act in 1974. And like in any other field, whether it is education or healthcare, Kerala is also a pioneer. So Kerala was one among the 12 states in India which passed the Water Act in that state. So Water Act is a central act. Then in 1981 came the Air Act, Air Prevention and Control of Pollution Act, and then came the Environment Protection Act in 1986. So this biomedical waste management rules was notified under the Environment Protection Act and the EP rules. So basically I am focusing on the biomedical waste rules because that will be applicable to the healthcare facilities. So I learned that the audience comprises of doctors and administrators, right? Okay. So I'm basically a civil engineer. My specialization is in environmental engineering. So though I am a civil engineer, whenever I go on an inspection, my focus is on how waste is managed in that campus, or however magnificent, however like grand is the building and all the interior. When they invite us, okay, ma'am, come and meet our PRO or the administrator. So I'll say, I'll just go check your sewage treatment plant, your biomedical waste handling area. The DG said, then I'll come to meet your PRO. Okay. So that is our area of focus. Because environment goes hand in hand with health, right? So unless we have a healthy body, we don't have a healthy mind. And to have a healthy body, we should live in a healthy environment. Okay? So that is our duty, and we all are like on the same page. That I have to make clear. Because whenever we say that there is a non-conformity with respect to some environment standards, what people say is that, oh, so many quarries and pollution control board is like they are against development. No, we are not against development. We are for sustainable development, where development goes hand in hand with environment protection. So our aim is sustainable development. We are not against development. So whenever we say that there is a non-conformity, that means that we are there to help you to overcome that non-conformity. Because you don't need an engineer, right, to point out the non-conformity. Anybody can, like, there are a set of norms. The answer is either yes or no. Whether there is an STP or not. Whether the DG set is acoustically enclosed, whether it is having the required stack height. You can either say yes or no. So what is the solution? That is where an engineer, the role of an engineer comes. Okay. So we are there to help you overcome the like whatever defect is there. We are there to advise you. We are there to help you to overcome that. So whenever there is a direction or a show cause notice, we even send this refusal intention notice and all, but that is part of procedure. Don't panic. You can always approach us. We are there to help you. So, okay, then I'll go to the topic. So, biomedical waste. You know how biomedical waste is coming. It is from the diagnosis, treatment, immunization, research activities, testing of biologicals, from health camps and all. So biomedical waste sources are all these. And next is like, what is the importance of handling this biomedical waste properly? First is, you might have heard of the principle, 3R principle. Reduce, reuse, recycle. So to reduce waste, the main thing is you have to segregate the waste properly. You have to segregate the waste. You should not mix it with other kind of waste. Then it will reduce the bulk, the volume. It is easy to handle. And we should always remember that human beings, our fellow human beings, are handling this waste. We get all kinds of complaints from the common biomedical waste treatment facilities that they got needle prick injuries. See, human beings, our fellow human beings are handling the waste, and whoever is handling the waste, we should treat them with respect. Because we are living a healthy life because they are toiling for that. Okay. Even if it is a sanitation worker of the local body or the waste handling staff of the common biomedical waste facility, treat them with respect. How can we treat them with respect? We have to segregate the waste. It is not that you have to invite them to a function and give a memento. Even that is, it should be done, I think. So you have to properly segregate. We have all large hospitals, and most of the complaints are against large hospitals. So you have to have a internal committee to audit how the waste is being handled. Okay. So you know the importance of segregation. Next is this is the status of healthcare facilities in Kerala as per the 2018 annual report. Okay, so I'll explain what this annual report is later. Now CPCBs, there is a Central Pollution Control Board. Actually, when the Water Act was passed, Central Pollution Control Board came into existence, and in every state or union territory, there is either a State Pollution Control Board or a Pollution Control Committee. So we are collecting annual report from the healthcare facilities. You may be knowing for every calendar year, you have to submit the annual report, how the biomedical waste is handled, how much biomedical waste is generated under various categories, how it is being handled, how it is being disposed, and you have to submit that in Form 4 of the biomedical waste rules, and then we will compile that report and we will transmit it to Central Pollution Control Board. So what their comment is that most of the healthcare facilities, they are not submitting the annual report. So again, the SPCB could not submit the annual report on time. So your non-conformity becomes a non-conformity on part of the state board also. Okay. Then Pollution Control Board consent or authorization is mandatory for every healthcare facility, even if it is having IP, whether it is a non-bedded healthcare facility, even if it is a Ayush facility, every healthcare facility except doctors practicing at home, consultation alone, that is not mandatory, but every other healthcare facility, the clinics, the scanning centers, all the laboratories, every institution in the healthcare field requires either a consent of the board or an authorization. So it's like if you have a bedded healthcare facility, if there is IP, not the observation bed, if there is IP, even if it is one number, you have to get consent of the board, consent to establish, consent to operate, and then the subsequent renewals. Okay. If it is a non-bedded healthcare facility, you have to apply for the authorization. All this is online. You can apply online, you can make the fee payment online. Now, this is BMW rule is applicable to, like I said, to all individuals who generate, collect, receive, store, transport, treat, dispose or handle any form of biomedical waste. So it includes hospitals, nursing homes, clinics, dispensaries, veterinary hospitals, animal houses, pathological labs, blood banks, even medical camps or schools having this first aid rooms, forensic labs, etc. So now, so you know who has to apply for the board's clearance. All these are clearances, authorization, consent. Now, handling of waste, of course, you know, it is like collection, then storage. You have to transport the waste to the common facility. Now, the common facility is offering like transportation. So, another important term is when you apply for the consent or authorization, there is always a term, occupier. So this was new to us even when we were joining Pollution Control Board. It is either like proprietor or managing partner or owner. The term we use is like occupier. Occupier, like it is a broad term. It means that whoever is having administrative control over the premises where this facility or the industry is located. That is the occupier. So the owner need not directly apply for the consent or authorization. Even the authorized signatory, he can apply. Okay, so the important thing is you apply for board's clearance. Now, there is this local body. Everywhere there is a role of local body, whether it is biomedical waste management or solid waste management, construction, demolition waste management, there is role of local body. So, local body should like allocate suitable land for treatment of biomedical waste. So, we only have 2 common biomedical waste treatment facilities in the whole of Kerala. One is in Palakkad. Of course, it is operated by IMA, Image. Anybody from Image is here? No. Okay. Another came up recently. It is operated by KEIL, Kerala Enviro Infrastructure Limited. That is in Ernakulam. So pollution, to avoid like clash, Image was having monopoly. Then KEIL came. So obviously there was competition. Okay. So when there are more service providers, you get better service. But there is like a clash of interest. Where to collect the waste. So Pollution Control Board intervened and we said that all the districts around Ernakulam, some 5 or 6 districts, they have to dispose the waste through KEIL. All the others, from Trivandrum to Kasaragod, they have to dispose the waste through Image. So Trivandrum, we have to dispose waste through Image, Kollam, etc. So only the few districts around Ernakulam are utilizing the facility of KEIL. Okay. Now, there is a state advisory committee who is monitoring the implementation of biomedical waste in the state. So, it comprises of departments of health, environment, urban development, animal husbandry, veterinary sciences. Then, of course, Pollution Control Board, Chukkillatha Kashayam illannu parayunna pole. We are there in every committee. Then, Panchayat Municipality Corporation. Then, representative from Indian Medical Association, Common Biomedical Waste Treatment Facility, and some NGO. And there is a similar district level committee also. And there is some amendment in the biomedical waste rule. Actually, biomedical waste rule was amended in 2016, then it was amended in 2018. So you can check all these acts and rules on the PCB website. I'll share the website URL. You can sit at your home and refer all the acts and rules. Okay, have a cup of coffee and read. Okay, I'm not going to go deep into the acts and rules. So I'll just, okay. So when this biomedical waste is like transported from your hospital to the waste handling facility, then there is a possibility of some major accident. Is a toppling of the truck, some accidental release is there, and the waste handling people, they will be having some kind of needle prick injury. Mercury spills may happen. So biomedical waste you have to handle with care, and there is like this color-coded bags with QR codes. So if some bag is found on the street or somewhere abandoned, then the QR code will trace it back to your hospital. So you have to be very careful with the biomedical waste packaging. So Image or some KAL will be giving you bags with QR codes. Okay. So what we have seen that is that whenever we go for inspection, So the general waste is also filled in these bags, and the bags are like dumped somewhere in that premises. So somebody will be carrying it, throwing it on the street, some into like some water body, and we will come after the hospital. Recently, there was an incident in Tamil Nadu where some biomedical waste was found dumped in some areas in Tamil Nadu. So there is an NGT case going on. So you have to be very careful because QR code is there. Okay, next is the duty of the occupier. One is to ensure that biomedical waste handling is proper. So I told you earlier. Then you have to keep this biomedical waste in a safe, ventilated and secured location. Everywhere you have this common storage facility from where the image truck is coming and picking the waste. It is like some damp corner with no lighting, no ventilation. So it should be in a safe, ventilated and secured location. Okay, where the waste is handled also, you could use some kind of aesthetics. Okay, it should not be all that shabby, damp thing. Okay, proper ventilation, lighting, and some like indoor plants you can give there. Okay, only the lobby and the OT. Okay, you have to do some work on where the waste is also handled. It can also look beautiful. Okay. Now, these things you can just read. So these are the duties of the occupier. I'll just mention two most important duties. One is to apply and obtain clearance of PCB, consent or authorization. Next is to submit the annual report on time. Okay, otherwise, there is another, whenever there is an act or rule, there is a penalty for violation, right? So you have an act or rule and then people are not obeying, then there has to be some coercive step. So one is environment compensation. So if your healthcare institution or healthcare hospital is operated without a valid consent or authorization, even if it is not valid, you had obtained clearance but you have not renewed it on time, then every day you are operating that healthcare facility, you are operating it in an unauthorized manner. So we'll count the number of days from the date of expiry of the consent or from the date of commissioning of your facility. Okay, so on the day on which the consent was renewed or it was granted, until that days, we will count 1, 2, 3 like that and into 5,000. That is the minimum environment compensation. Earlier it was like you have to give a direction, then you have to give a show cause notice, then you have to give a closure intention notice, then another closure order. After that also that occupier is not obeying the board, as a final resort we can approach the judicial first class magistrate court. For that again we have to serve the prosecution notice, get sanction from the board chairman. Now it is like you count number of days of violation into 5,000, serve a notice. Okay, it has become more easy with the National Green Tribunal. So National Green Tribunal has given us this power. And to Pollution Control Board, there is like unlimited power, but manpower is like 0. 25% of my office is sitting right in front of me. So it is me and 4 assistant engineers. We are running the entire district. We are involved in all the environment matters of the district of Trivandrum. But that doesn't mean that we don't have the power. If we find one non-conformity, then sure, we are going to be after you. Okay. So these are the duties of the occupiers. I'll share this I have already shared this PPT, so the organizers can share it to you. So these are it is self-explanatory. Now you may be knowing about the biomedical waste categories, right? We have 4 categories. Earlier it was prior to 2016, we had more numbers of categories. Now after the 2016 amendment, there are only 4 categories and those are color-coded. One is the yellow category. So yellow category basically is like human anatomical waste, animal waste, soil waste, expired, discarded medicines, chemical, microbiological waste, etc. Then comes the red category. Okay, I think I need to check my eyes. So it is like recyclables, all the plastic waste that is generated as part of a treatment. The catheters, tubes, urine bag syringes. Then white is, of course, you know, the needles. Okay, so how it has to be collected and stored, it is written. Next is blue is for glassware. Okay, so these are the 4 categories. And now when wherever you handle the biomedical waste, usually the nursing stations are where the biomedical waste is kept. So this chart has to be displayed at the nursing station. Okay, so that they don't mix the waste. I went for an inspection recently in one famous hospital, and I could find disposable teacups in the biomedical waste. So you have to be very careful. Some internal audit has to be there. So display this schedule. It is the schedule 1 of the biomedical waste rules. You can easily download it from the website of the PCB, or just check, like you can search for biomedical waste rules 2016. It is available on the internet. So this you have to display at the nursing station or anywhere where people are handling biomedical waste. Okay, to ensure that it is properly segregated and disposed in the correct color-coded container or bag. Now this is the biohazard symbol you might have seen on the trucks of image. This also have to display where biomedical waste is handled. And next is for the cytotoxic hazardous symbol. Okay, you know what is a cytotoxic chemical is. Next is, again, Schedule 1. So it only explains how to handle the biomedical waste. Next, I told you about barcode QR system. So it is there on the bag. So it will be traced back to you. Whatever waste has been transported from your healthcare facility to elsewhere, with this barcode, we can trace it back to the place of origin. And now there is like, PCB is also developing a software. And even Central Pollution Control Board, everybody is developing software so that we can trace the waste, even solid waste, every waste there is a tracking system. And we are also quite advanced with technology. Okay, so we have this website, we have the tracking system. Whenever we do some inspection, we can map the institution or industry that we have inspected. You can't say that this person has not visited our facility. Earlier it was like that. We point out some non-conformity. Somebody will be mentoring them, so they will be saying that, no, this officer didn't visit our premises. So we have also become smart. Okay. Now this is a recommendation for storage facility of biomedical waste. So nobody is operator of biomedical waste facility is not here, so it is not relevant to you. Now, handling of waste bags, that you have to train your staff. Okay, so bags must be replaced when they are 3/4 full. And pick up the sealed bag by its neck to avoid needle puncture. Okay. Then transportation, it has to be very careful. Then there should be a biomedical waste management committee within your institution. So this is another thing is, people ask us whether we can have a captive facility. Captive facility means this biomedical waste treatment facility, they will be charging you per kilo of biomedical waste. So somebody, some people think that, okay, you can give a captive facility on site where your hospital is. So if you want to give a captive facility, it is okay. Only thing is, you have to be aware of the standards for incineration, pyrolysis. There are different treatment methods like autoclaving, microwave, then deep burial. Even if it is if it is liquid waste, then there is another set of treatment. It has to be given to liquid waste before disposal. So all these are given in detail in Schedule 2 of the biomedical waste rules. Now this is Schedule 3 also, it says that you have to submit annual report, the need for authorization training. Okay. Now told you for improper handling of biomedical waste, there are certain penalties. We can go for like any violation of an environmental statute is a criminal offense. Okay, so you should not treat it lightly. Now there are certain like we call it original application. These are cases under consideration of the National Green Tribunal. So we have a National Green Tribunal which deals entirely with environment matters, and even a layman can just write 2 sentences in a white paper and email it to NGT. NGT will suo motu take the case. So that is a scenario at present. So we have to be very careful with environment norms. Okay, now I told you about EC. EC is environment compensation. So the various factors that we consider while assessing EC is whether you are authorized, whether there are any arrangements with the common biomedical waste treatment facility where the segregation is proper, whether there is pre-treatment of waste, whether there is proper storage facility, whether there is an effluent treatment plant. In hospital, it is basically sewage, so effluent treatment plant is called sewage treatment plant. Then whether there are any other non-compliances. Okay, so these are the things that we check while assessing environment compensation. Sorry, I am not trying to scare you or anything, but this is the rule. Okay. Next is the online application I told you. Okay, next 2 slides I'll just wind up. Okay, online application, you can go to the Pollution Control Board website. Directly you can go to the consent management website, that will be keralapcbonline.com, or you can just go to the official website of Kerala State Pollution Control Board, that is kspcb.kerala.gov.in. From there you will be redirected to the consent management website. Okay, so everything you want to know about the acts, rules, norms, circulars, guidelines, SOP, everything is on that official website. So you can go through the website, read all the norms, and even if you find something like you don't understand, then you can always reach out to the nearest district office of the board. We have a help desk, we have a kiosk from where you can e-file your application. Okay, so these are the facilities that we have made available to the public. Even though we are understaffed, we are handicapped, again we are offering whatever is possible with the limited staff in 24 hours. Okay, thank you.